This is Trach Care. Here's my patient. Here's my little station I'll be working on. The first thing I need to do is assess the patient. If he needs suctioning, listen for lung sounds. Just hear basically. If you ask the patient, you can do multiple things to see where you're at. I would also assess for pain, make sure there's nothing going on. I would also explain the procedure to the patient. Also, I'll let him know if he's having any difficulty, just raise his hand and we can stop. So yeah, to start off, I would have to put on PPE. First, put on your gown. First you put on your gown. Just do this really quick. This would be full protective PPE. I also would be wearing a mask. Just, you don't want any particles going in your mouth or in your eyes. But for now, so you can hear me clearly, I'm not gonna put on a mask. But no, after I'll be putting on a mask. And then the gloves will be gown, mask, gloves. I would also, before starting, I'll place a towel over the patient's chest. I would check if I would check for suction, a little thingy. I would make sure it's at 150, or basically, 150. I would have the ambu bag a little on my side, and from there on, I can move on to starting to set this up. Start off, I'll have this in the bed. Face the patient, open it up. You can just drop this. There's a sterile. Have this little box. And you open. You just pop it open just like that. Okay, now since I have the box set up, I can pour in my saline as much as you need, of course. We can start opening our package. Here we have a little catheter to suction. Here we have sterile gloves. So we'll remove these, throw them in the garbage. Now we'll put on these gloves. It's a bit tricky, so make sure you're doing it correctly. This is the way. That is not the way. This is the way. Alright. There we have the gloves on now. I can grab this, move it out the way. I'm gonna have one hand non-sterile, one hand sterile. At this point, you have to choose. Usually I have the bench right here. So I'll have my left hand as the non-sterile, my right hand as the sterile. So here we go. It's like this. It becomes contaminated. Manipulate it with your right hand. You'll plug this in a little suctioning. From that point, you'll have it connected to the suctioning. And you have this hand, and make sure this doesn't fall. And now we want to wrap this around. So we have that. That's perfect right there. And then from here on, you're going to dip it in your saline. Use this hand. And just feed it on through. Basically, you're going to hear suctioning. You want to go in, rotate it around. And you can do this 2 suctions. You're going to allow 3 breaths in between. So you're going to go in, suction it, twirl it while you're in there. Twirl it, just twirl it. Keep going like this, just twirl it and take it out. And then you want to flush it with saline. So we can do that. And then from there we can do oral hygiene and oropharynx care. And also we will use the ambu bag in between, pump it, give him the 3 breaths that he needs. That's what I was referring to as the 3 breaths. We use the ambu bag. After that, we wrap this up. Now once we have all this completed, I'll wrap it up in my hand, remove it, and then I would remove my gloves. Then I will pull the gloves in between, and put in the other hand, and do this. And there, we have it all ready to get disposed of. And drop it in the garbage. Next we make sure to stabilize the trach plate. We would remove the cannula, which would be like just removing it. And put on a clean pair of gloves. I'll make sure the trach plate is stabilized. Remove the cannula from inside the trach plate. Remove the cannula, remove the cannula, and then remove the dressing around it. And from this point, we can open our Trach Care. We can open our Trach Care. Show the patient, open it that way, put it down. So now this is open. Here are a new pair of sterile gloves. Now we're done with these. I'll put these on. Remove these, of course. Throw it out. And here, I could pour in my saline in this little spot. I should probably done that with the gloves on. Pour the saline right here. Now, it's connected. Now I'll put on these sterile gloves. I believe this is the right way. There we go. touch the outside. So just adjust that. And then flip around. And here we go. There you go. So now I have a new pair of sterile gloves. Pick this up, you can drop it there. Now you can manipulate the stuff inside. Here they give us a little towel, a little dry sheet so you can put on the patient. You put the shiny side down, just like that, over the patient. Now we have these. These we would use to clean the trach plate on each side. Is one side sweep. Dispose of this. Grab another. Just keep it sweep. Dispose. Sweep. Dispose. And sweep again. So that's 4 times divided into the 4 quadrants. You would also, there'd be no cannula, you grab a new one. So now we would have the cannula in saline, stick it in, not all the way, don't push it deep, you just want to stick it in, don't want to put pressure, hook up, whether it's bending up, stick it in and rotate it counterclockwise, and it should latch on. So that's that. So you should have a new cannula in there. And we can now move on to these dressing, which we could use this one. Basically, this turns into a clean procedure from here on out. Just go in and just slide it in underneath, just like that. We would also clean the thing wrapped around the neck. We will switch out the band, put a new one in, and that's that. Basically, that's it. Now we remove PPE, take off your gloves, oh, already messed up. Use my gloves to take this off. Now I'll take off my gloves and then slide out of your PPE.